Hi, my name is Gigi Comfort. I'm a student nurse here at Bellarmine University, and I'll be doing medication preparation for Miss Mary Colbert. So before I do her medication preparation, I do want to make sure that I do have the right patient and all of her credentials as well. So the patient's name is Mary Colbert. The date of birth is 04/18/1955, and her medical record number is MR101955. I would verify that against her drawer, and I do see that her name is Mary Colbert. The date of birth is 04/18/1955, and her medical record number is MR101955. Okay, so I want to make sure that I do see the medications that she's going to be taking today. I see that she's going to be taking a pneumococcal vaccine, which can easily be an IM. The dose is 0.5, and she needs it to be taken once. I might give it to her at 8 o'clock along with the other medication. Also, do you see that she has to get an adult multivitamin? The dose is just 1 tablet. She has to take it at 8 o'clock, so I'll get that done as well. And lastly, she has and that's orally. The multivitamin would be orally. The last medication that I'll be giving today, or preparing today, is an insulin, and that's going to be sub-Q. I do also want to make sure that I give it to her at 8 o'clock. And it's a sliding scale order, so when I do prepare her medication, I do want to act accordingly to that sliding scale. So the first thing I'm going to pull out is her tablet, the oral medication that she'll be taking today. So it is a multivitamin. I do want to make sure that it's not expired. We don't want to give any expired medication to anybody. So in the case that it would be expired, I would just get a new tablet and throw out the old one. So this is a multivitamin, and it's done orally. It's for Mary Colbert. Okay, so the second medication that I want to do is a pneumococcal vaccine. I see that she needs to get a 0.5 milligram dose. In the case for her, let me make sure that I sanitize again before I'm touching the needles. So for pneumococcal vaccine, I do want to make sure that I am getting a needle according to her weight. I see that Mary Colbert's weight is approximately 185 pounds. If I divided that by 2.2 to get kilograms, it'd be 84.09 kilograms. So with that size weight, I would get a 1-inch needle for her. I'll show that I am. This is 3 ml. And I'm going to get her a 1. Okay. So we want to make sure that we get a 1-inch needle for her for the pneumococcal vaccine. So I am going to wipe down the vial. This vial could be used by anybody in the medication room. So I want to make sure that I am not using it before I wipe this down. So this is a 3 milliliter syringe. It shows on her MAR that she needs 0.5. So I'm going to bring it back to 0.5 when I do get her vaccine. So I'm going to put this back down. Okay, so I'm going to touch the tip of it. It's the sale side. So I can twist. So for her pneumococcal vaccine, it does show on her MAR that she's going to get 0.5 milliliters. So I can take the tip off, bring it back to 0.5, and I can put it in the vial. So I do want to make sure I put in bubbles so that when I bring it back, I don't have as many air bubbles. So I'm going to bring it back, making sure that I get it to 1.5. I'm going to tap it to make sure there's not any air bubbles. I can bring it back out. So I don't see any air bubbles, so that's good. I do want to put the top back on. Okay. So with the pneumococcal vaccine, it is not labeled, so I would put a label on it just so like I don't misplace it and I'm trying to look for it everywhere. On the label, I do want to make sure I put her name. So it's Mary Colbert. I'm going to be doing it intramuscularly, so I am. The drug is the pneumococcal vaccine. I'm going to be giving it to her at 8 o'clock, and the dose I'll be giving is 0.5 ml. So I'll just put this on the tip. Okay, I can put this aside along with her tablet. So the last medication I'll be giving Miss Mary Colbert is a regular insulin. With the regular insulin, I do have to make sure that I am taking into account her blood glucose amount, and I found out that her blood glucose is actually 100. So with that rate, I would have to give her 3 units of regular insulin. And I'm going to also be giving it to her at 8 o'clock as well, along with her IM vaccine and her tablet. Okay, so I do want to make sure that I'm wiping this down. Okay, and the cool thing about the insulin needles is that there is an orange tab, so you know immediately that it is insulin, so there's no need for me to label that. Okay, and I'm going to touch the tip of it, and this thing right here. So for regular insulin, I do see that like I said before, that she'll be getting 3 units. So I want to pull back. To 3. Alright. So I said that she'll be getting 3 units. I'm going to push it inside, taking out any of the air bubbles. I'm going to bring it back. Okay. Drop this. Then I'm going to tap it to make sure there's not any air bubbles. And then I would put the cap back on. So when it's pretty close, I can put the cap like this. And like I said before, the insulin does not need to be labeled because of the orange top. But it is, it does need to be checked by a second nurse just to verify that I am giving her the correct amount. So I would need a second nurse to look at it to tell me how much is, how many units you see.
Yes, I see 3 units.
So she does see 3 units, so I am good to go, and I'll be able to give that insulin to Ms. Colbert. So just to go back and check all of my my medication, this would be my second check. I do want to make sure that I am giving a multivitamin. She's supposed to be getting it at 8 o'clock. The expiration is not yet arrived, so that's good. And she'll be taking this orally, and she'll be taking 1 dose. This is her insulin. I see that she needs to be given this at 8 o'clock as well. She'll be given this sub-Q, and it's on a sliding scale, and based off of Miss Colbert's blood glucose test, I verified that she will be getting 3 units of this. Lastly, Miss Colbert will be getting a IM pneumococcal vaccine. I see that she's going to be getting that at 8 o'clock as well. It is intramuscular, and she's going to get 0.5 ml of the vaccine. So there's that. I also want to make sure, in the case that the drawers do get switched around, that these are all in for Miss Colbert. So I see on here that's for Miss Colbert. Miss Colbert is on the drawer as well. This is an insulin specific for Miss Colbert, 3 units. So there is not a tag on there, but I know that it is for her because it's 3 units. And lastly, there's a multivitamin that she needs to be taken at 8 o'clock. Do note that all 3 of these need to be taken at 8 o'clock. And this multivitamin is orally done in this 1 tablet. So after I've made sure that I've gotten all of her as in order, I do want to hand sanitize before I do take it to her room. But I am done with her medication, and that's the end of my skill.